Excellency, the 45-year-old Kwanwoma Teaching Hospital Maternity and Children's Block Complex has also started. And this time, I can make a firm promise, Your Excellency, that the project will be completed on schedule within your time. Other facilities which have witnessed similar sword-cutting ceremonies and have either started in earnest quite recently or will start within the next few weeks are as follows. The construction and equipping of 12-story maternity and gynae block at Kolebu Teaching Hospital. Construction and equipping of urology, nephrology and kidney transplant center at Kolebu Teaching Hospital. Construction and equipping of Tema Sub-Regional Hospital, Nkranza District Hospital, Doma Accident and Emergency Center, and the construction of the Central Medical Stores at Tema. Construction and equipping of 12 new hospitals in the following locations: Jumapo, Kwabin, Nkwetia, Edukrum, Achiasi, Suame, Drobonso, Sabronu, Mansum Kwanta, Hwedie, Mim, and Ponkatamanso. Your Excellency will commence by early September by the contractor Vamed Engineering. Mr. President, all these projects are in addition to the Agenda 111 facilities that you are about to cut short for the first one to commence at Trade here. At the community level, Your Excellency, work has been completed on the construction of 41 CHIPS compounds in selected communities across the length and breadth of the country at the moment. Mr. Excellency, all these 41 CHIPS compounds were started during your time and they have all been completed. From the foregoing, it is obvious that government's commitment to achieving the SDGs and universal health coverage cannot be downplayed. Bringing primary healthcare services to the doorstep of communities and individuals remains on the agenda of the government, and this, I promise, will be delivered without fail. Excellency, ladies and gentlemen, as we are testing today, the government is contributing a lot towards the equitable distribution of health facilities nationwide, and I will urge all partners involved in the construction of these projects to work assiduously to ensure that the projects are delivered on time with value for the investment. To address the COVID-19 issues, treatment centers have been constructed at the 37 military hospital, Pantan and Dodua. These have been completed and they are in use at the moment. Works are currently also ongoing for these treatment centers at the Kumasi Treatment Center at Sewa, at the Akulindevota region, Zevila in the Upper East region, Sevilla Sawenso in the Western North, and Kolebu in Accra. Other sites are Sunyani, Takradi, Narerigu, and Cape Coast. Excellency, all these treatment centers have got financial coverage, and we have promised to complete these in good time for our use. Whilst the government is putting in measures to provide the necessary infrastructure and the requisite medical equipment, I appeal to all and sundry to adhere to the COVID-19 protocols of hand washing, wearing of masks, and social distancing to mitigate the effects of the pandemic. With these unprecedented investments, His Excellency the President will not waver in his commitment towards deepening healthcare delivery at all levels and ensure that Ghanaians have access to high-quality healthcare. Now, ladies and gentlemen, to conclude, I will urge the community to cooperate and take good care of personnel that will be posted here when the facility is completed. Give them the necessary support so they will in turn give up their best. We are building a partnership, and the long may this partnership continue. I want to thank you for your attention, and may the good Lord bless us all. I thank you.
Thank you very much, the Honorable Atwima Kwanwoma, Minister responsible for health. Daebia wodia osun. Daewe nipa odi kan esun ya. Waka nipa bomu a enega na nyina eta ye kire no. Ide de Nana Adodampa Ekufuado. Enche bia oni ebe kasa. Na nananom yɛbaeɛ no mo se amammerɛ yɛn ntontwene enti moayi akusika frempɔma dorinda sɛ ɔno ɛna ɔmmɛgye president tata ma ne mfa nanodisɛm embrɛ. Shall we receive akusika frempɔma dorinda?
Ɔmanpanyin Nana Addo Dankwa Akufo-Addo nananom atena konya ɛkuni ne anintina yɛhyiam wɔ ha ɔman ne mu mpanimfoɔ Ghana manyina mema mo nyinaa moakyio ne dia ne Nana akusika frempɔma sɛ na megyina ha na mese Nana mesi a meyɔ Nana Addo Dankwa Akufo-Addo Ghana man da wase a ɛnsa do mfie mmienu ne dunsia 2016 ɛna ɔmanpanyin Nana Addo Dankwa Akufo-Addo yɛnyina yɛkɔ adwenkorɔ de kɔm anibrɛ ɛto abama Nana Addo Dankwa Akufo-Addo sɛ wɔna wofiri ɔsono abusua mu ɔsono kukurudu ɔsono a yɛdi mɔkyi a yɛmmisa wɔwea ɔsono a yɛdi mɔkyi a yɛnte ha suo mo na moagyina kasampere bɛpɔ so ato bopɔn to pɛnkora ma bopɔn da na so korɔ so ama mansantwe akuma adidadie moayɛ bi da yɛnim sɛ ɔhaw amanneɛ ɔhia da ne yɛmfutu kukoni dum so ahodoɔ a yɛnam mu yi ɔbɛgye yɛn afiri mu nokwasɛm ɔyɛ asere wɔaduasa buo baako adeɛ kye a wɔɔkyinkyini kɔba nyinaa ɔse Ghana man yɛnsiesie ntia ɔnyina a wɔma asansa didi pame asona ne wɔyɛ kube asona duampem kwadehyɛ konkura so ketewa so adwareɛ ɔso wɔyɛ asona ba wɔmpere kwa wɔpere de gye adeɛ wɔwie no ɔsa so wɔyɛ kɔba na wɔmmeɛ enti me yɛ asansa a mefa adeɛ a mede kyerɛ mefa nso a mefa ne boom maka no meyɔ ɔhyɛ bɔdi bɔhyɛ so Addo Dankwa showboy premeni Dankwa Akufo-Addo wɔyɛ bio Ghana man yɛsɛ yɛbɛkɔ so ade wasedaka wɔna wɔhyɛ yɛn bɔ ɛsɛ wɔbɛma yɛn free SHS ɛfiri sɛ ɛbra na ahokyerɛ adɔkorɔ Ghana man na yɛka yɛn nsɛm kyerɛ manpanyin dada na wɔde hyɛ adum ne adan no Nana Addo Dankwa Akufo-Addo mɔborɔhunufo agya tema agya abadayɛ agya wɔbaayɛ no wɔabɛyi nkɔnnua kɛseɛ wɔyɛ firi yɛn kɔn mu the free SHS aba ɛsɛ ɛmɛ nyina yɛnkɔ SHS free wɔ abura yɛntua teku dama sempua kaprempa na ɔmanpanyin Nana Addo Dankwa Akufo-Addo sɛ nempo yɛ na wasia enkyiri ma bɛba ɛbɛka sɛ bɛma ba wobɛyɛ bi yɛbɛkɔ so ade wasedaka hwɛ Nana Addo Dankwa Akufo-Addo ma yɛte aseɛ sɛ wɔnyɛ nhyɛ han ɛma man foforɔ ɛmfa wɔn wurabasɛm ɛne wɔn krakyesɛm ɛnsisi yɛ man Ghana ne sɛnti no wɔsɛ mmɔfra ne yɛn daakye mmɔfra ne yɛn anidasoɔ mmɔfra ne bɛtumi ama Ghana atumi atu mpɔn akɔ so enti free SHS na yɛntua teku ne dama no ɔyɛ nimdifoɔ ɔyɛ nwomanimfoɔ ɔyɛ kukodufoɔ ɔyɛ nimonyamfoɔ na nimonyam nyira bɛdwam enti na free SHS no SCP Esita Ashiri Ejina amanpanyin Nana Addo Dankwa Akufo-Addo yɛda wasia ensada ansoha wasade planting for food and jobs abaye planting for food and jobs abaye ekwama ye friend sekwam ebinde yana na yesi wa manpanyin Nana Addo Dankwa Akufo-Addo ba campaign yɛda wasia ensado Ghana ma yɛbada so ada wase eba COVID-19 to ayem pofrim na ni da so asaye na yɛbisa yɛ wɔ sɛ ɛhemfa na yɛkɔ efisa na nkrɔfo gye sɛ Ghana de yɛn kan fraho kaka wani tibremu na Nana Addo Dankwa Akufo-Addo yɛn sɛnkyerɛni ɛma yɛhunu ne sɛ saa Ghana yɛ ɔman Joseph a wɔma yɛ US mmɔda biara de wɔma yɛn didi da obi ka kyerɛ yɛ sɛ warenam no aka dompe nanso Nana Addo Dankwa Akufo-Addo baayɛ wɔse meyɛ Elijah mekasa namba ba dompe ne ho ɛna de wɔyɛ adwuma ɛnam ba dompe ne ho sɛ yɛdidi ɛma yɛhotɔ yɛ COVID-19 brɛma ne ɛso ɔmanpanyin Nana Addo Dankwa Akufo-Addo bɛrima bɛyi apampamira wɔtera wɔtaba nso ayɛ akata so akata mpɛmpɛm adagya so wɔnkwa so eburu wɔnkwa so asɔr wɔn a wɔma yɛn 4 interchanges 1 district 1 factory 1 village 1 dam 1 constituency $1 million 1 constituency 1 warehouse single ticket inflation online passport passport application anso o man penyin na na do dan kwa kufuado wa ya bi wo say empenyinfo ne kasem bi aboa patubre wo so obi benyame na me yade inti yade na mo nyanko pasachi osu se ne ho se ne tibone enti na do dan kwa kufuado ba ma ba won kwa wo so dan so wote chimase ena oba ye no o se wo ma ye hospitals ya we biara we dia fabra won tena ho magana njingu entetem pansamosa enti na do dan kwa kufuado wa ye bio Ghana man be koswa dawase afia chemu ya ena wo share ye bo na bidu se won tumenye nanso wa kira se mimi frama nyoko papa mu ye dia mamo papa na bo masuo enti mentena ho anya nhye han ema Ghana njingu se enne bo shana bama ni yeso wo shopodi bo shase na do dan kwa kufuado onyina wo ma sansa didi pame asre wadua sabuo bako ade che wo chinchiri kwa banyina wo se wo man se etia bama ba osiprekete otripuku so nyare sabuo kwa nyasa bin kama kanta wo so ya bakoso ade wasedaka enne ase hospital sero e wase mensni bia enya ayare sabia mantam nsia bama banyansani nimdifuo ono na wodira kwanchan kwapa wo hubi enti ya friend se ahunta hute katre wono na ma abato ena se waba na se wo hyase e wo tra de kurodua yi mu a ne asema mpanyini yenya wudeni wesemanhia wenimdifuo wenwomanimfuo Ghana ma yanhia wa enka wo wotiri modemfo de wo afa dodoa na wo COVID-19 bremi nana yeda wose Ghana mai bekoso ade wasedaka moni adwuma pa wonkwaso aburu wonkwaso aso se enne nana ado se wo ya na moma yanka hunu se suputupu dum abrewa na abrewa dum supurupu ena bra supurupu dum sopropa na sopropa dum supurupu enti moma yanyina yanfa na adugo na womu enyedu na wontumi nyina pinti enfa yare sabia dodoa na emna ayame menewo ya dachintia ayame menewo ya pamudintia shanipa ba konsanso nyame ani kato ena ba kufo redu so egu penyimfo mpose ba kufo so nchiredanfo moma yanyina yanka hunu ne se apese wo hoi oyakasia onyamfa ayamadufuchie ana no maba anasa akokoba ono so fukosiamu na baaye woye meye no mampanyini ya Ghana bekoso afa ne ntoma pefra ama yaka yafra hunu se ye wo mai na do bema ba wonkwaso Ghana mai ye bekoso ade wasedaka mo ani adwuma pa adwuma ra mpunti adwuma ra wonkwaso a okudonto
Okay. Thank you very much, Akusika. Now we present to you the precious gift of the nation. The President of the Republic, Nana Addo Akufo-Addo.
Eminent clergy, Chief of Staff in the Office of the President, and officials of the Presidency, Ashanti Regional Minister, Minister for Health and Member of Parliament for Doma Central, the Minister for Local Government, Decentralization and Rural Development and Member of Parliament for Okre, the Minister for Works and Housing and Member of Parliament for Bantama, the Deputy Minister for Defense and Member of Parliament for Atwima Kwanwoma, members of parliament, CEOs of state agencies, Nana Echina Kwejan V, the representative of Asante, Nana Nobi Mfra III, Trader Hine, the General Secretary of the New Patriotic Party, Ashanti Regional Chairperson of the New Patriotic Party, residents of Trader, fellow Ghanaians, ladies and gentlemen. Eddie Ade Fragana Afanena, and Yabia no Bia Titrino, it's over Mamma Quine, Madden or Potomo. Today is a happy day for Mother Ghana, and I'm glad that it is under my tenure as President of the Republic that the biggest ever investment in the nation's health care is being made. We are met this morning because of the ravages of COVID-19, which has affected every country on the planet. For us in Ghana, not only has the pandemic disrupted our daily lives, but it has also exposed the deficiencies of our healthcare system because of years of underinvestment and neglect. Indeed, in update number 8 of the Fellow Ghanaians series, I indicated that COVID-19 has revealed the unequal distribution of healthcare facilities in the country, as we have tended to focus our healthcare infrastructure in Accra, Kumasi, and one or two of our other big cities. As we have seen, epidemics and pandemics, when they emerge, spread to any part, can spread to every part of our country. We discovered that there were 101 districts in the country with no district hospitals, and we had to do something about it. The creation of the new regions also meant the government had to construct 7 regional hospitals for the new regions, including a new one for the Western region. See to the construction of 2 new psychiatric hospitals for the Middle Belt and Northern Belt respectively, and rehabilitate the Afian Kwanta Hospital in the Western region. This led to the formulation and declaration of Agenda 111. Following on from this initial announcement, a lot of work has been done to help make this vision a reality. And I'm delighted to be here with you in Trede to cut the sword symbolically for the commencement of construction of these hospitals across the country. So far, 88 out of the 101 sites have been identified, including this one at Trede, the site for the construction of the Atwima Kwanwoma District Hospital. Work on the other 87 sites also commence today. The acquisition of the remaining 13 sites will be completed shortly for work to begin. Each hospital is being constructed at a cost of $16.88 million United States dollars. That is 12.8 million United States dollars for construction and 4 million United States dollars for medical equipment. All the hospitals are to be completed in 18 months. Work will commence on the regional and other hospitals in the latter part of the year. These modern, fully equipped state-of-the-art hospitals will have facilities for outpatient services, including consultation facilities for medical and surgical cases, ophthalmology, and dental services, a physiotherapy unit, maternal and child health unit, public health unit, 4 state-of-the-art surgical theaters for maternity, obs and gynae, accident and emergency, and for general surgery and imaging facilities. In addition, each hospital will have the full complement of male, female, pediatric, and isolation wards. Provision has been made for support facilities, which will include a kitchen, laundry, sterilization department, mortuary, energy center, maintenance department, and staff accommodation for doctors, nurses, and other health workers. Ladies and gentlemen, Agenda 111 has been carefully thought through to inspire activity and growth in various sectors of the economy and also help bring jobs to the youth. It is a Ghana First agenda, and the following facts will help make the point. Firstly, a consortium comprising some 20 Ghanaian consulting firms made up of architects, civil, structural, electrical, and mechanical engineers, quantity surveyors, biomedical engineers, and other technical teams have designed these hospitals to reflect our unique domestic requirements, including impact of climate, socio-cultural conditions, and traditional practices. They will also supervise the construction of these hospitals, which will be built by some 250 domestic contractors and maintained by domestic facility management professionals as part of government's policy of developing domestic capability in the building and construction sectors of the economy. This will undoubtedly help retain most of the money in the country to engender further investment in the economy. Secondly, the hospitals are of a standard design and construction to provide a blueprint for speedy and cost-effective implementation of future health infrastructure programs in the country. Thirdly, the execution of Agenda 111 will require significant domestic inputs, which will give impetus to private sector investments into the One District, One Factory policy. I expect Ghanaian entrepreneurs to take advantage of the opportunities provided by the significant investment and produce quality building and construction materials required by the hospitals. Fourthly, we have incorporated into this agenda a strategy of direct and indirect job openings to stimulate the economies of the various communities in which the facilities are to be located. These include the creation of an estimated 25,000 jobs during the construction and design phase, i.e., jobs for architects, civil, mechanical, electrical, and biomedical engineers, quantity surveyors, masons, carpenters, welders, steel benders, painters, tillers, and related professionals and artisans, as well as other indirect jobs. Once completed, it will provide job opportunities for some 20,000 health professionals, and thus enable the Ministry of Health recruit more doctors, nurses, pharmacists, and other health professionals. In addition to these, there will be many indirect jobs for residents in the local economy. For example, for persons who will sell food, drinks, hospital consumables to the hospital, its staff, patients, and visitors. I am confident that this important investment will have a positive impact on many lives and livelihoods in the respective communities. Ladies and gentlemen, beyond the building of these new healthcare facilities, my vision is to help make Ghana the center of excellence for medical care in West Africa by 2030.
Thank you, His Excellency. God bless you.
Leveraging on Ghana's favorable status in the region as the most peaceful country in West Africa, a beacon of democracy of the continent, and a land of opportunities. This we will achieve by investing more in the development of our healthcare infrastructure, mapping our regional health facilities to specializations, as well as upgrading selected facilities in our regional and teaching hospitals into world-class standards. Excuse me. India and South Africa have shown the way in this regard. The relevance of this is reinforced by the fact that West Africa by 2030 will have a population of 500 million people. The goal is thus to position Ghana as an attractive medical destination with excellent medical facilities for our neighbors to patronize. Several countries have benefited from international medical travel. Benefits to these countries include enhanced GDP growth, improved healthcare infrastructure, foreign direct investments, tourism promotion, and importantly, halting the brain drain of skilled medical professionals. Indeed, research has shown that in 2016, for example, Africans spent some $6 billion United States dollars on seeking medical treatment abroad, of which Nigerians, our great neighbors, alone were responsible for $1 billion of this. In order to take advantage of the huge potential for medical travel, we began during my first term in office a program to revitalize healthcare infrastructure in our premier hospitals. Investments were made in the Kolebu Teaching Hospital in Accra to build a new 400-bed maternity and gynecology block, and a new 100-bed urology and nephrology center of excellence. The government will build on this foundation and include 2 additional projects currently in the planning stage, namely the Trauma and Acute Pain Center and a new surgical service block with modern inpatient facilities. These major investments in the Kolebu Teaching Hospital will contribute to its transformation into a modern world-class teaching hospital. Further investments are being made in the Komfo-Anokye Teaching Hospital in Kumasi, beginning with a new 550-bed maternity and children block, specialized centers for infectious diseases, orthopedics, cancer treatment, cardiovascular health, specialist eye care, among others, will be assigned to some of the regional hospitals, including those to be constructed under Agenda 111. Whilst we upgrade facilities, we should invest in medical education and training of our health personnel, including expanding the use of IT for medical diagnosis and treatment in the Agenda 111 healthcare facilities being developed. This network of primary, secondary, and tertiary healthcare facilities will form the backbone of the vision to make Ghana the leading healthcare destination in West Africa. It is envisaged under a public-private partnership that the Ghana Medical Corps, a volunteer corps of medical specialists, which will tap into the skills and resources of Ghanaians and non-Ghanaians locally and abroad, using IT and telemedicine to support the delivery of healthcare and training, will be established by 2023. This will offer, in particular, to Ghanaian medical experts resident outside Ghana the opportunity to give back to their motherland in ways that will support and expand healthcare delivery. All these programs collectively will position Ghana as a medical travel destination in West Africa, with the potential to add some $2 billion United States dollars to the nation's GDP by 2020, and in the process, create some 50,000 jobs in the sector. The implementation of Agenda 111 will be a huge undertaking, requiring commitment, cooperation, and diligence on the part of all: government, professionals, contractors, traditional rulers, opinion leaders, workers, and residents of the various communities to enable it succeed. We owe it to each other to prove that we can do it. Let me conclude by thanking the various stakeholders, especially the hard-working project coordinator and consultant, Kwame Nyako, and the conductor of the orchestra, my redoubtable chief of staff, Akwesua Frema Osei Opare, who have worked tirelessly to enable this project take off and remind all of us that we continue to experience the effects of the third wave of the pandemic. It is important that we continue to adhere strictly to all the protocols and directives government has put in place to protect lives and livelihoods. Continue to wash your hands under running water. Use alcohol-based sanitizers, hand sanitizers. Wear a face mask and ensure social distancing. These are the weapons of our welfare as we strive to reach the target of vaccinating 20 million Ghanaians, i.e., the entire adult population. I'm very hopeful that by the grace of God, we are on the threshold of something remarkable in Ghana. And I expect that within the next 18 months, God willing, we will all be alive and in good health to witness the commissioning of these hospitals. May God bless us all in our homeland, Ghana, and make her great and strong.
A round of applause for the President of the Republic, Nana Addo Dankwa Akufo-Addo. All right. Amampayi yabatinas na sene na Nana Achina Kwajan Okaye no. Project yesa share na amafo say oh President Asmo Kende e won tututu hospital magu 80 there away waye Amampayi also diaper ojude hu yie na Amampayi ba be okobia nso ya na okasa chen okasa na abebuom na Your Excellency have been following your wardrobe and then Amampayi okasa chen aso okae no na tadie e da wache na ohe Amampayi ne tuma no didia e kasa chen asante mamemu ye ka entuma e wasechre ene Amampayi na tadie no anasa entuma no ni din ene se woni sika ye ntwa blocks woni sika ye ntwa blocks Amampayi wase wanye sika ene wotwa blocks ro awoha enti entuma no e kasa chen se ampa ni amoka nyina da wontimi wase wo sika wotwa blocks na blocks no so ye kwakwaye e wo ha eno na megyina so na matumensa adia frɛ Mr. Kwabena Nyako ono ena ye project consultant na adofan so mo kyerɛ so e bai e ade a Amampayi afei the chief of staff and afei otufo for Kesia Oha and the honorable minister of health and Ashanti regional minister Ebeka Nanacha de Hineho na Omako Babia exhibition ewo yegyina yebetras na omopai yekohwehwere mu sane yeye no ni asefo nyina blog no ha ne wo omopai kowia na yasan ato djumadi ni so enti nana terahi wadama wopigyo mu na wabaka omopai ho ha na kyese yekọ exhibition grounds wo
Yes. Ebusuafo ye kai mo se da so a ewo trade ya ewo Atwima Kwanwoma mensi mu ewa santimantami mu agenda 111 hospital projects eno na ede yen ababedru ha mampani akasa otumfu si anemu akasa baby adri omo asori akọ baby a site no ebewo na ye de asofi no ekobo fom wi a na chese gina ho e de ama omamu ni nyina e de ye kan nyina bom na se de MC Kwame Adinkra eka ye no wo se agenda 111 no trade ho na yegina nti ho ne de agenda 1 de aka no enyina 110 nso wo baabi foforo ne mu agenda 1 no ene trade ho na wo se de omo aye architects no adro enoma ni nyina de agu eye epono so akọ a se de ade ne tie no wo se dan ye besi a yetimi artistic impression ne de agu wo ye a washroom beba ha ye consulting room beba ha ye a ha be waiting area car park beba ha bibia be kama nti cameraman na ko gina ho architect na wo ya ade ni gina ho a ono nso so explain o chechirem said de tie oduyefo na sabre ni ma me afie nyaako e wo standby e wo ho nti e beda ne de aka ne de ama wo mo na baby ankomodie na kodu no mato aso afi ho e de ama ye me kai mo se me ni Bismarck Brown bibi e ne da so e wo studios mu ha oduyefo wo tie yin a so mo ho ma ye yo akuya yeso yasom me ne ma me nyaako yara so agina ha sen Metronka, Otimenka, Masum Dada, Otimenka. Hello. Yanti Odiafo. Hello. All right. Metronka, Otimenka. Yeah. Hello. All right.
But utie sene otumfo na musini kasa na there are doubts nkofo jidisi hwa na am emma so ntino asudie kese da mampani so ne so behwe amasa no kre na bamu se project ne beba so yemfanto so ne manenye ho se ne be ya
asama no wakane ye nkoma na edi wa
no kwasem
eche se benifone social media no mko bi na ye de ofiase a waka me se papa yi ene so hwe oyepati TV ansa na ne okọ trade na ni nyina no eye se 111 district and municipal hospitals se mampani no ne aban ni timi ye ho adwuma bibi metimi aka kyo se 2024 omo campaign adwuma na abaye ne ho so timi ye so within a space of 1 year obo de baye ni nyina wo timi ya 2024 campaign omo baye ne baye kakre adwuma na abaye ne ho enti omo ma na ni omo ni nkoso na ne bibi adwen ye omo anaso ye bi telephone lines kura no ye callers ni bi nso can the same thing eche se we na koye political ade we na nti yenhwe na nyame ma ya hoden ne nkwa na yenhwe afintam de wa nso nhye da nwa bi asa na che se dwuma ni nyina ebe koso concurrently trade de ekoso no na western north de ekoso na we de ekoso nti ni nyina 1 year no na yetumi awie ne saa me say nka ebeti pressure so e wo konfa no chi ne kolebu bebre e wo saa kwan no so baby
nti sese na ye hwe no eye mampani architect ne contractors no kire no se ne facility no etie ene se ne ebeko afa, and that's what we are watching right now. Oduefo sorti enka wona ogina ho boye mu potin na contractors ne ka kire mampani.
Okay, Medasi, baby, what make us say ana?
Mete won kapa.
All right. Ya move a free baby a no mampani kasa ye no. Ya ba baby a hana homana kasa no. Ye betwemu, but he said ye hwe no. Eye Rene beka say architectural drawings. Architectural drawings no eye adan na ye besie no. Ho drawings a ye enka ye ka beka say building plans a hodo no. Ye ne ye technical eyes no ye hunu say adan ho a ye the cross section of the building, cross section no ho afi ye wo ahodo to say front elevation and elevation and in yakeka ho. They say contractor no kwabana nyako wachechire mu awie ya ye nyina ye movie to baby a omampani ba ye shortcut na mu ya abusafo ya ba honom enti ya bo hwe omampani ya empanifo ni ntini etwe ne ho ahia na afei na obaye shortcut no ankasa eti said mo hu no aye shortcut na mu na omampani yes say live ewo Oirepa TV ye wo trade see the background so no Ghana Jom na ye bono doma ewo ha no enyagro mamenyako ewo menchen na enche meja kasa mu no e de ama mamenyako na wono so atro so e de ama ye said ye ohwe mpanifo e ben o mampani pay a otwa ahomanu mu no owie ya wada wo ho ya oseba etino eye otumfo asinemu nana achina kwajan afi ya osi otumfo nan omampani na mu nana ado danko akufo ado ora stevena mu asteka empanifo ne doso omodoso na abusafo omunyina akoboa ma nana ado ode aso abofom yi awie ya ose ko baby ana ote ya okasa ye no eti ye nyina so sade mu hu no ye ne dom nyina se ko back to the background so ankasa na the empanifo ma ye no omo ama ya so ate make say ora candidate kwesi kankam atwa manim. All right eti no abusafo the draw eno no see make say the Nanado danko akufado anya de asono abofom awie na de oye ne se ode mortar na ofa trowel kan ne friend trowi ya ode boy. Now we are back to babia ye beye architect no ora kwabra nya ko beye nchirechire mu no etu hwe headline na Atwima Kwanwoma District Hospital ene woso emfoni amuhunu nyina aye omo a edan ye besie no womo designs ahodo ene plans ahodo no ena ye hunu no senka ye behunu efom ha pa ye hunu reception ena wa ha no eti reception enu nie now ohia reception na ye wo walkways eti enipa ena be nante e de afa ha nyina ye fi hono ma walkway ni nie ye hunu se de eno so ebi wo fom ha sei afi abusafo ye basoro kakra ye hwe we aya district hospital na mu eti symbol so ne se de hunu no hunu se baby atwa 1 no aya reception baby atwa 2 aya administration. So those of you watching us live on TV, mo na beboa more than FM4 no. Number 4 aya physiotherapy sania ya number na ekom eti yako plan so a right mama hwe baby a ye behunu number 1 no ewo hoso Number 1 in here. It you number 1 we are. Now I refer to her just a reception. And now administration block. I am number 2. It is from the number 1. This is administration block. Yeah, akratisam ewa. So basically, plan ankasa any way and technical your friend ground floor plan. Technical sorry friend. Now over here asura. Over here ground floor no plan asura. Uhuno entry bi wa hanom where building diagrams. All right. I don't know. Yara Paul say ewa ha. Ono na ye project consultant ya pese ye na di nkomo. All right.
The
senior project manager. Mr. Paul say from HIC. Right. Ye na papa ebedi nkomo kakra. Papa ye da say wadaroma ye pese o kire ye drawing si ye de ne hu but mo na mo technical eyes no e de na ewo hoyi.
Wo hwa ha say ya won. Any hospital no. Say e fence. Anojofa no hospital no any sale hu no bi oh and the map is was here every location be IC hospital no it was so the district no 101 district hospitals 7 regional hospitals and need 2 fencing psychiatric hospitals for psychiatric hospitals you will be that will keep close in Accra and you see by ko Kumasi you see by ko so Tamale to serve both the fencing finfini any sroho any Accra there so e be modernizing no and the way no what no hu no oh into the hu no what na wa into aha no all more or less no female ni male what any courtyard. Because I NBB, say you design in such a way, say, a said a hot no. It will be my eye for some motive or my affairs, or hands and grab you. So I'm a tap on tap. And I was inside the world, and in daylight, a pictorial view, a drone shot. And that's what I say.
Let's just say, was on the baby idea for the bedano.
And I had such a way, say, walk out, bet up on them. Senate, no. And they say, making sure as a design of my designs are making sure some take into consideration as a Senate, Abuchi Senate, and BB and you know. Uba Hasa owns a friend no site layout no site layout and anyway who know any site layout no bon and I know all the wards no any ancillary services bibia ho I said that I for no be the any the laundry any I say oxygen bibia
when the bibia facility bia be cost hospital bia ni I
have to say staff quarters and I district hospitals omo mo gina ho no for no omo no mo design
okay
my money professor beauty omo no mo ye
and when no so ye den
no, also so be remu a. One if a reception area.
Yeah.
Bon, reception and all. Say you na dey be machine. Am I call 77 na won na asomdwe. And I say also hand reception so no also na all. And a walkway. I do call what so.
Yeah, Miss Osa said you see who no fefe on krata so yi. Sana e be fefe on the ground right you be hu feel sa.
You see what you see is what you get. Send a hu no. Sa na ye be see no. Bibia hu infoni so no. Enu an obe hu. And the quality of materials need bibia enu an obe hu. Enu an dey mamo.
Yeah. Miss Osa President Amaya Swante say 18 months. Just say afi ba ko ne fa ye betimi awie. Mobetimi di so say dey ya waka no.
Yeah, say na waka no. Say na waka no. I district hospital so no. 18 any regional no so na be ko chiri kaka nso anche bia any be say 2 years and omo regional so no
edru ba bia mota ka say ye wie ya enye ye sikasem te say mo say bibia ye ready
oh yeah mo hye ni bibia ho any budgetary approval bibia budgetary allocation ni ade nyamo ya san hye no and na as far enti no say e ba eno ano no na ekoso na say obi aso ti ase say say project bi ani wa problem say mbem but no say make sure say bibia si a ye be resane ye be no ama bibia akoso todo
Mr. Osai my title ne bi opposition
me senior project manager of hospital infrastructure group.
All right. Okay. Yene Mr. Paulo say ana ebon komo yi yeda so awom ba bia architectural drawings no ewo no na say de mahu no basically say ye si dan no a say de dan no be ye pepepepepepe ene ne ewo nkrata so a fili agani say ye gina ye de ani hunu bia mo so mo hwe bia no eti wa kyerɛkyerɛ mu nyina no e de akyerɛ ye na I think say ba bia duro no ye be sa go back to ba bia president mo ewo no na yakoto so e de afre ho no nti no mo ye krado a mo betima som e wo studio na ye be sa ba back enche bia right
Director of TV Becca no say it's a wrap.
It's a wrap.
Nti na che say yes sorry ano no. Abusuafo say president wakati so ordinary wie no wasengu concrete aka ho. Wo sani ahyehyɛ blocks kakra bi ho. A me hu yes what mortar ni bi. E di ewram na che say edan na ye maso no na fe wa break grounds no or de ade na bofo mo a. They say die wo so mo hit the road running. Na ye nhwɛ na afentam no. Nyame ye yadom na wo de enkwama yen ya 2022 August say ya yebehwe yebekọ na yakohwe ba bi ade na dru say ye mia no kran commissioner at least we say dru appreciable level bi a omanfo betimi ehunu say de nneoma no esitie ti bi ye sorry no akua
ye sorry no na yebeda ahwefo ase wona mo ne yen afiase afiti no nsia ebesisa mre na de me fa no say extended version of OBT yebeda mo nyina ase ye ho abotra mo nya ene suma mo ne ye nyina asom yeda team ne nyina nso ase director Philip tete obo echiri de den anas nso ejina mu den kwaku enso ejina mu den a ohwama cameras ne bibia akoyie team no nso ewo grounds no nso yeda o mase ene nso Godfred ena hwe ama production ne nyina nso akoso ewo studio ha head of production James Star and so ejina mu den on location together with Danny our head of technical of course Richmond Frempong so a producer of OBT in Sujinamu mame efie nyako ene oduyefo yeda se adrobafo nso a modi team no so kwa mu nyina maka ho bi ama no aye kama ochina nopa yebesen hia ne asom asanteman ene Ghana man ebiem eya momiehwe nya ahweye na yenkoso from the studio there yewie but we're taking you back to Trede na niaka nyina nso oduyefo ne mame efie nyako ede atoaso midin ene Bestmark Brown eya frame BB
mesumidi ede akwese do abusuafo say the BB aka no asen when the news trickle in we will fill our viewers in enti mun koso ne yentra ene ye listeners wo radio nyina edamase adopa
Oyerepa FM Nyame sempa Ensempapa Kasapa Ubenya no oyerepa Nyame nyom papa Efutu ankasa Nina ubenya no oyerepa Oyerepa FM 100.7 Oyerepa FM 100.7 Oyerepa Efri Nyame 100.7 Yede efutuo mu nsem twekunkro mu nsem 100.7 Bible mu nsem efutuo mu munche 100.7 Oyerepa every nyame o nyame
consultants no any data scene na episode share chief executives and members of parliament that be is hospital Thank you for the 111 begins right here in Trede. And we thank you so much for your presence here. We adore you and we say thank you. We'd like to invite the regional chief imam to give us a closing prayer. Let's welcome the regional chief imam.
Sapa ubenya no
Midna ha Emre bi 96 say your bumpire man on flag bearer no near see office be antimi anwie and I'll say your bumpire man on ya oba be see ama o share bo no share ma ento e guguro fo o share bo a o share na ma yes ka say be bumpire ama no nya Ghana akonya no na ebo ma so yes de nyankopon say umu ye ni ma se da bibia be ka bia no o share na ma Emre bia mpaebwa na beboa ne se nyame ma onkwa nyame ma odin nyame ma yukoduro ye obeka bia nyama ntumi nya ekoshe bia wa hye nyama ntumi hye ne ma ekoshe bia hye bia nyama ntumi hye ne ma nam se kunu kudura Ghana ntumi bu Ghana mai betimi ni o betimi ni na se unya dia o betimi nti yankopon se betimi Nyakubon so beboa ye bomb devia me sora na pansa na ko nyam da me bomb pa e ma wo me bomb pa ma san no we nyam da adam say ye na bomb pa ma ba ye cha wo chi ene mpa bo emre bia wo na wa panfo nyina ye ma me so da no ye bomb pa e ma nyina na be muam na omo mu bibia enye yi ma mo na sa 111 no na what is that Look at 275 ambulance. Ebusu. 111 no. Ebusu. The bonfire say, "Ubisi ama na burusu." Na be mwa ye nyina. Na doctor health minister okay say who see you so amen. So I'm going to baby say no me supervisor. Supervisor. Akoda na be kasa hand su na to nyina na bisu. Obona na baso nana e bompire ma wo mu ye ni mase ye gusu bompire ma so do kwa wiye pa nyama nana nyame nku anofa nyame nku awia nyame nku anajo nyame nku kura nyama ntna homai Allahumma ansur Ghana wa ansur raisana nana akufuado wana ibahu alhadi الدكتور محمود بوميا وانصر جمعيات MPP برحمتك يا ارحم الراحمين يا رب العالمين اللهم الف بين قلوبنا واصل ذات بين